Good morning. Good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is your daily medical tidbit. It's getting a little cool out there. Fall is upon us. What I want to talk about this morning is keloids. Okay? Keloids. And I want you to know that it's more than just a scar. And we have to be educated on that because it's very common among people of African descent. All right, and many of us have seen it, even experienced it, whether it's around the earlobe, in the back of the head, or wherever we've had any type of laceration or surgery. Right, so they're raised, they're itchy, and they can be painful. And the key for keloids is they grow outside the radius of the wound. So they can grow bigger than the original wound and continue to grow, right? So keloid is not your typical scar, all right? So it could be a scar from anything. Ear piercing, as I mentioned, even acne you got to be careful with, burns, surgeries, right? Our body wants to heal these scars, right? It wants to heal this wound by putting on scar tissue. But in keloid, the scarring process does not stop within the limits of normal scarring, right? So it goes into overdrive, right? And the scar tissue keeps growing, spreading beyond the boundaries. And I've dealt with folks with large keloids from shaving, okay? I've dealt with folks who have earlobe keloids from ear piercing, all right? And it's firm, shiny, right? And continue to enlarge over months or even years, right? And it can happen to anyone. However, it happens in mostly black people, okay? Studies have suggested that up to black individuals up to 15 times more likely to develop keloids, okay, compared to anyone else. And there also seems to be a genetic component. And if your family member from keloids, your risk is higher. And research has shown that it runs in family. And they think that there is some sort of dominant inheritance pattern, right? So that means if your parents has a tendency for keloids, then you have the chances of developing keloids. Not always, but just something to be cognizant of, all right? And there's a lot more in terms of the research and the science and collagen and all that, but we're not going to get into that, right? I talked about where I have seen keloids, and the most common areas is the chest and shoulders, the upper back, the earlobes, and even the cheeks and the jawline, all right? And that's from acne. So try not to pick your face and do these kind of things when you have scars, all right? So it's important, okay? It becomes a cosmetic issue, really. And they are uncomfortable, right, because of the itching and the tenderness, and they can get painful to touch, all right? So again, and if they happen over a joint, because the joint you keep moving, it restricts your movement over time based on the size of the keloid. Management has become challenging. It's always been challenging. And many things have been tried, from corticosteroid injections, right, which tends to be the first line, right? You inject into the scar, hoping that it will shrink over time, right? There's different types of gels, silicone gels, that you can apply to the skin, But again, these are not very successful. Cryotherapy, which is freezing the keloid with liquid nitrogen, but that's for usually very small keloid, right? You can try laser therapy, which flattens the scar and can reduce redness, and ultimately surgery, cutting out the keloid. But this actually has a very high recurrence rate, all right? So you have to either combine the surgery with the steroid injections or even radiation at times, all right? So just some things to know, that it's not an easy thing to treat, all right? There is no single treatment that works for everyone. And again, these are the kind of conversations the doctors should have with the patients, because again, it becomes a very troubling issue for the patients, especially from a cosmetic standpoint. So we have to be, cognizant and be fragile in terms of, how we give the information and how we proceed to help these patients, all right? Prevention is the key in this situation. If you know you form keloids easily, or your family, there's keloids in your family, right? Avoid unnecessary piercings. Don't do tattoos, right? Treat your acne, with certain medications. Don't go picking into it, right? So these are the kind of things, the precautions that you can take. So keloids are more than scars. They're overreaction of your body process when it comes to healing, right? It's common among us black folks, right? And genetics play a major role, right? So management is tricky, right? And all the options that I've given can help, but sometimes they don't help, right? So you have to understand that if you have a keloid that's growing, that's painful or bothersome, don't ignore it when it's small. Talk to a dermatologist, talk to your primary care physician, go and see a surgeon, and an awareness and early care can make a huge difference. Okay, so remember that. And again, this is me just giving you a little bit of information on keloids. Have a great day. I'm Dr. Dangleben. Peace.